Welcome to Health Matters. I'm your host, Kareem Amiri, and today I'm welcoming Laura Jackson back. Really excited to have her back. Laura is Wellmark's Executive Vice President of Health Improvement and Chair of the Wellmark Foundation. Laura joined us, you joined us twice now, I believe.
Yeah.
And I think the last time was almost a year ago. We just discussed how your team is working to improve the health and well-being of all Iowans and South Dakotans. This is appropriate time now with National Rural Health Day coming on November 20th for you to come back and give us an update of all the great stuff that your team is doing.
Yeah. Thanks for having me back, Kareem. I appreciate it.
Yeah. Would you mind just giving the audience a really brief reminder of your position at Wellmark?
Sure. Kind of a refresher of our team.
Yeah.
So we're very fortunate. We have a small team, but we literally are dedicated to looking at how we can help all Iowans. Like you said, whether it's Iowans and South Dakotans that buy our product or not, we're looking at our entirety of our states to find ways that we can help them live longer, healthier lives. And that's really our mission.
So I know you mentioned your team is focused on the health and well-being for all Iowans and South Dakotans. Can you describe as to why that is?
Well, so one of the things that we know, Kareem, after really spending a lot of time understanding, healthcare cost increases, we know that cost increases are unsustainable for so many. And we also understand that while healthcare is something we all need on occasion, if we understand what creates our health, it's so much more than just healthcare. It's actually where we live. It's how healthy our communities are and the way in which we all have access to services, and we can actually choose healthy choices. And when we don't have the access to those things, we all suffer. So I always like to say we're only as healthy as the least healthy person in our community, which means we all have to help each other.
That's a great message, and such great work that needs to be done for everybody. So when Wellmark is assessing the opportunities or looking for partnerships that make the most sense, and I believe I missed out before, we're definitely working with partners throughout the state in these rural communities. What types of problems are you trying to address? And how are you making those decisions, or how are we making those decisions? And for what type of approach for the project? For
sure. So when we think about specifically the problems we're trying to think about, a lot of times they're called wicked problems, if you will. Mm-hmm. And it's a phrase that was coined a long time ago to basically say they're big, they've happened over time. There's a lot of people that have kind of had their hand in and out of it to actually create or improve the situation. So when you think about your health, it doesn't happen in one moment over one day. It happens over time, and there's a lot of variables. So to tease that apart, one of the things that we do is we look at a lot of data, and we bring all that data together to understand, especially in rural, why people are dying of more preventable disease in our rural communities, and importantly, why they're dying at younger ages than maybe their counterparts that live in the urban areas. And so once we look at the data, then we're a curious team. And so we spend a lot of time talking to individuals that are doing great work to solve some of these problems, as well as people who live in these communities to say, what are the barriers? So you help us understand why these things are happening, so we can actually point our resources, whether that be technical resources, financial resources, to find those things that can change the trajectory of their lifespan and their health span.
That's great. And I know you said in the past you've come from a rural community, so I'm sure that's gratifying to do that type of work. And you just mentioned again, and I love that word wicked. I shouldn't say love the word wicked problems, but that just accurately describes the situation that it is. It's a terrible situation that's occurring. So what are some of the themes that work looks to address? And tell a little bit more about your Wellmark's focus on that problem and how the team is addressing it.
Yeah. So when we look at the data, I get asked this a lot. So, what are the things you see every time you look at the data? And we found themes, and so that's exactly what we call them. And each time in both states, what pops up is the health or lack thereof of some of our moms and babies. So when somebody decides to get pregnant, and the health of their child and access to services so that they can have a great start at life. Another big theme is access to mental health care. And knowing that a lot of our kids are really suffering, which kind of pivots into that next theme, which is our youth. our youth are really struggling, especially in those rural communities, with a lot of different things. And so when we think about whether it's moms and babies, whether it's our kids, whether it's access to mental health, we know that really getting to things earlier in kind of our lifespan, if we can help these folks live in a better environment with stronger communities, we know that we can improve their longevity, but importantly, have a better, healthier life. And that's why we focus on our themes.
Yep. Trying to get to it sooner in life it just makes sense.
Absolutely.
You don't have to look at all the data to know that, but it just makes sense.
Right.
There's definitely initiatives that we're taking, and you mentioned a little bit about them. Can you speak about a couple of initiatives that we are partnering on and launching or have launched?
I would love to. And there's two that we're not only proud of, but very excited about with our partners. So one of the first things in Thriving Youth was to understand some of the mental health challenges with kids. And we spent an awful lot of time understanding, in rural communities, sometimes if you just imagine I'm a mom and a dad and I have a child who's struggling, and at school people recognize it. But if I had to take off time from a job and actually travel, and I could get an appointment, which might be 3 months from now, that's an awful long time. And maybe I don't have the ability to take time off my job and take a whole day to take my child to an appointment. So we started spending a lot of time with Department of Education and talking to superintendents and people in these rural communities to say, could schools be the basis for where we actually bring those services to the kids, of course with parental permission and in partnership with the schools? So we spent a fair amount of time understanding what the gaps were and what the state of Iowa is going to do with regard to kind of reimagining the way behavioral health and mental health services are delivered. We found ourselves in a situation where we could be kind of a gap provider, if you will. So we tapped the Wellmark Foundation and talked to the board and literally said, we believe if we gave these schools, dollars for about the next 3 years, they could bridge the gap, provide those services, go upstream and actually intervene with those kids much sooner. And we decided to then do a grant program of $5 million that was available to rural schools. And we are proud to say we have actually allocated all those dollars within a very short period of time. We're really anxious to hear feedback from teachers and parents and superintendents, and we truly hope that this is life-changing, not only for the child, but also for the family member, the teachers, the superintendents, because if they can't help a child with their most basic needs, it's hard for them to learn. And we know that learning and getting through school is so very important.
That is great to hear. When the announcement came out as a Wellmark employee, it made me very proud to work here. But it's great to hear that it was allocated very quickly, and I'm sure it was much needed, and everybody was happy about that. So that was one initiative. Is there another initiative? That's the first one. Okay.
So it's kind of be careful what you ask for, right? When you're spending time with people asking about opportunities, the relationships and the connections and finding other people to work with happen very naturally. And we had been looking at rural in particular, not only from a mom and baby perspective. So we know that over half of our counties actually have no obstetric providers. And we know that we've got a lot of maternity care deserts. In addition to that, we started looking at first responders and EMS and some of the gaps that are there, because a lot of times they're a volunteer. So we know that well over 50% of EMS responders in our state are volunteers. So they're working a day job and they might be called. And that led us down a path to say, if you're in a rural community, how do you get trained on some of the most challenging things that you might not see every day? So much like an athlete, if you aren't practicing all the time, you don't have the muscle memory. And so we were actually introduced to the University of Iowa in the College of Nursing, which is called, this program that they have is called Simulation Iowa. And it is 3 different trucks that actually cover the entire state. And they do what I would call high fidelity simulation training, clinical hands-on training for the care continuum of first responders. So think about, I had this experience, right? So my brother was a volunteer paramedic or EMT at the time, I guess. And if you're in a farm accident, let's say, and you call 911, you're really realizing that volunteers are going to come and help save you and bring you to the nearest hospital. So this was an opportunity to make sure that those first responders could get free training from the simulation trucks, because we talked to them and they basically said, we can't afford this training. We can't take time off for the training, But if the truck can come to us and somebody else can help us afford it, then that is game changing. We actually know that we save lives when we get access to those clinical training.
And I think I read within the truck they have state of the art equipment.
It's amazing.
Yeah.
And Cream, they simulate in a way that is phenomenal, right? So they might stage it as a farm accident that's 12 minutes away from the hospital, and they actually make everybody participating in the training behave as though it's that entire time frame that they have to stabilize the patient. The patient can talk to them, they can cry, they can wail, they can bleed, and it is the closest you can get to real training.
Wow, that's amazing. Those are amazing examples. And are there any real life, maybe
good stories?
Good stories, yeah, or anecdotes that we can share that have occurred in the recent time that these have launched?
When we evaluated this, so we also kind of tapped the Wellmark Foundation, and we provided $5.3 million to make sure that Simulation Iowa could be accessible to all 86 rural counties, and they could receive the training 2 times per year, each year for the entirety of the 5 years. And so in order to make that kind of a financial decision to know that it was going to really work well, we talked to a lot of paramedics. We went on site with some folks, and we heard stories literally that said we were trained one day, and within a week we were presented with that situation, maybe a mom who was going to have a baby, or it was complicated, and they actually knew how to handle something and save a life. So we know it's making a difference every day, and we're excited to keep collecting those stories and share those back with everybody.
Wow, it just makes your heart feel good hearing something like that.
It does, because it's scary to be in a rural setting or a frontier setting in South Dakota, for example, and wonder if you're going to have the same kind of life-saving access that others do when you live in an urban setting. And we believe that everybody should have access to services.
Yep, can't say it better. And I know in the past we've talked, and you've said that we've talked with other Blue plans. We're part of an association, and we have employers that have employees that are all throughout the country. Is there continued dialogue with other Blue plans and what they're doing in rural? Because America has a lot of rural spaces.
We do. If 40% of the folks in Iowa live in a rural space, 50% in South Dakota are rural or frontier. Every state has something similar to that. And what is really unique about the Blue plans is we share all of our great stories together. And so we know there's simulation trucks in other states, and we're like, have you thought of this? So where we can solve the wicked problems, we want to share best practices across all the Blues, and we continue to do that today.
So those are great. And in addition to connecting and funding those programs, I know as Wellmark employees we're doing some new things. Would you mind sharing a little bit about that?
I'd love to. We stepped back and literally we were so excited that our employees were equally kind of passionate about this strategy to improve the health of all Iowans and South Dakotans, and really thought about the fact that we all live in communities. And if communities actually create over 80% of our health outcomes where we live, work, and play, could we really inspire employees to not only do what they have been doing, because so many of our employees do volunteer and give back, but could we do it in a much more comprehensive and meaningful way? And so we came up with an approach called Be the Reason. And what we are doing right now is really tapping into the heart and the head of our employees. So we're giving them facts about, did you know how many people in Iowa and South Dakota live in a certain condition? Maybe housing, maybe it's access to services. Because sometimes I think it's easy to just think that life is the way where we live, and it can be so different in some of the places. So that's kind of from the intellectual perspective, is to educate on the facts. But then from the heart perspective, we're telling stories. We're showing what a difference it can make when we all invest and go volunteer in our communities, because that is the way that we're going to improve the health of all Iowans and South Dakotans. If we can get more people to give back and understand that, we're trying to dispel myths. So because someone might not have enough food on their table, but yet maybe they carry extra weight, that doesn't mean that they have enough food. It means they probably don't have access to healthy food. Right. So we want to really break those myths down and help all of our employees understand, one day that you give back, you might be the reason that somebody has a roof over their head or food on the table. And we can take that so for granted sometimes. And our employees have rallied and just absolutely loved this. And we'll continue to do it for as long as they want us to.
I know it's one of the things that I love about Wellmark. And, when I interview people and they ask, hey, why Wellmark? This is definitely one of the top things that come to my mind.
I think you come because we can actually make a difference in people's lives, and we can also actually provide health insurance. So we get to do both.
It's fantastic. Well, before we leave today, is there any last thing you want to share about the initiatives or the team?
I'm just excited to be able to share with you some of the results as we start to collect the stories, but also the statistics. And next time maybe we get to hang out together. I'll talk to you a little bit more about some other things we already have in the pipeline. So
that would be
just
awesome.
Thanks for always having us back, Kareem, and talking about this.
Thank you. And it's been great to see the evolution of this from the first time we met to now and where it will go the next time we talk.
Yeah, it's a journey. Thanks so much.
Thank you. So thank you all as well for tuning in to this episode of Health Matters. We hope you found the information valuable and insightful. And please, if you enjoyed today's discussion, go on to the Wellmark YouTube channel and see the rest of the Health Matter podcast. Thank you again.